Bismillahirrahmanirrahim. Assalamu alaikum. This is me Nazir Ahmad from Pakistan. Today we will learn about routes of drug administration. If you are new on my channel, please subscribe to my YouTube channel and press the bell icon button so that you may not miss any upcoming video. Routes of drug administration has been divided into almost 9 categories overall. So the major categories are systemic and local. Among systemic, there are further two subcategories like enteral and parenteral. Enteral has three classes and parenteral has five classes. We will start from enteral. Enteral have oral route, sublingual route, rectal route, and parenteral have intravenous route, intramuscular route, subcutaneous route, transdermal route, inhalation route. Let's start from enteral route. Enteral routes of administration are those in which the drug is absorbed from the gastrointestinal tract. Oral route is one of the category of enteral route. Oral route is a route of administration where a substance is taken through the mouth. Absorption pattern of oral route. It is variable and affected by many factors. Advantages of oral route. Safest and most common, convenient and economical route of administration. Disadvantages of oral route. Limited absorption of some drugs. Food may affect absorption. Patient compliance is necessary. Drugs may be metabolized before systemic absorption. Number two, sublingual route. Sublingual route involves placing a drug under your tongue to dissolve and absorb into your blood through the tissue there. Absorption pattern of sublingual route depends on the drug. Few drugs, for example, nitroglycerin, have rapid direct systemic absorption. Most drugs erratically or incompletely absorb. Advantages of sublingual route. Bypasses first pass effect, bypasses destruction by stomach acid, drug stability maintained because the pH of saliva relatively neutral, may cause immediate pharmacological effects. Disadvantages of sublingual route limited to certain types of drugs, limited to drugs that can be taken in small doses, may lose part of the drug dose if swallowed. Number three, rectal route. Rectal route uses the rectum as a route of administration for medication and other fluids, which are absorbed by the rectum's blood vessels and flow into the body's circulatory system, which distributes the drug to the body's organs and bodily systems. Absorption pattern of rectal route. It is erratic and variable. Advantages of rectal route partially bypasses first pass effect, bypasses destruction by stomach acid, ideal if drug causes vomiting, ideal in patients who are vomiting or comatose. Disadvantages drugs may irritate the rectum mucosa, not a well accepted route. The second category is parenteral route. The parenteral route introduces drugs directly across the body's barrier defenses into the systemic circulation. Number one, intravenous route. Intravenous route is the direct administer of medications to the systemic circulation. Absorption pattern of intravenous route. Absorption is not required. Advantages of intravenous route. Intravenous route can have immediate effects, ideal if dosed in large volumes, suitable for irritating substances and complex mixtures, valuable in emergency situations, dosage titration permissible, ideal for high molecular weight proteins and peptide drugs. Disadvantages of intravenous route. Unsuitable for oily or poorly absorbed substances. Bolus injection may result in adverse effects. Most substances must be slowly injected. Strict aseptic techniques needed. Disadvantages of intramuscular route. It affects certain lab tests like creatinine kinase. It can be painful. It can cause intramuscular hemorrhage precluded during anticoagulation therapy. Number three, subcutaneous route. Subcutaneous route is the insertion of medications beneath the skin either by injection or infusion. Absorption pattern of subcutaneous route depends on drug diluents, aqueous solution prompt, depot preparations, slow and sustained. Advantages of subcutaneous route suitable for slow release drugs, ideal for some poorly soluble suspensions. Disadvantages of subcutaneous route pain or necrosis if drug is irritating, unsuitable for drugs administered in large volumes. Number four, transdermal route. Transdermal route is the route of administration wherein active ingredients are delivered across the skin for systemic distribution. Absorption pattern of transdermal route. It is slow and sustained. Advantages of transdermal route bypasses the first pass effect, convenient and painless, ideal for drugs that are lipophilic, thus requiring prolonged administration, ideal for drugs that are quickly eliminated from the body. Disadvantages of transdermal route. Some patients are allergic to patches, which can cause irritation. Drug must be highly lipophilic, may cause delayed delivery of drug to pharmacological site of action, limited to drugs that can be taken in small daily doses. In number five, inhalation route. Inhalation route is a route in which drug is administered by the nasal or oral route. Absorption pattern of inhalation route. Systemic absorption may occur, which is not always desirable. Advantages of inhalation route. Absorption is rapid, can have immediate effects, ideal for gases, effective for patients with respiratory problems. Dose can be titrated, localized effect to target lungs, lower doses used compared to that with oral or parenteral administration. Fewer systemic side effects. Disadvantages of inhalation route. Most addictive route. Drug can enter the brain quickly. Patient may have difficulty regulating dose. Some patients may have difficulty using inhaler. The last route in among categories is the local or topical route. A topical route is a route where medication is applied directly to a particular place on or in the body, such as skin, nasal or buccal mucosa, and eyes. Thank you for watching my presentation. If you have any question, please write in the comment section below.